Where did you come from and how did you get to Asana Care?
Hi, Phil. Hi to everyone, and thank you for inviting me. It's a pleasure to be here. I'm a GP by trade. I trained in Australia, out west, so further west, which is Perth and WA. And I had a long career in the health system space, working as a consultant for governments, advising on health system reform here in Australia, in the UK, in systems in Asia as well. And I became fascinated with how we can change healthcare to support people to better health. And it's really come to a head, I suppose, through the pandemic, where there's a great awareness and focus on our well-being. And it's so important. There's such a huge opportunity for everyone to look at their health risk factors and to achieve the best possible outcome for them and their family. So my background is clinical, as well as in business and health policy.
And so let's talk briefly about Asana and what it's there to do, what someone could experience as they come into it, because we'll get to the reason why it's really important for what we're looking at doing in mental health. But as far as the Asana um, program and setup is concerned, what would be a typical sort of experience for somebody coming new to Asana?
The main change for our service is to see your doctor and a team of professionals when you are well, and not just wait until you get sick. And what your mission statement, Phil, and your team really resonates is health and a transition that's accelerating. So we think of the health system. There's an opportunity to focus on health rather than sickness. We believe there's a transition, and we're trying to spearhead that transition in the medical industry. And we think there is a heightened awareness that is going to accelerate our need for greater preventative care. The experience that we provide to our members is essentially a regular review based on risk factors. So we use a industry standard risk stratification score, which is a way of segmenting the different risk levels, if you like, for our patients and their families. And we put together a tailored plan that addresses those risk factors over time. And our members get long appointments with a dedicated GP. They get the support of a health assistant, and then they can have input from a health coach, dietitians, exercise physios, psychologists, all to keep them healthy and help them achieve their health goals. So it's really forward looking. And we've got a track record now of keeping thousands of our members as healthy as possible and almost doubling the industry standards around healthcare.
And so I find that really fascinating because so much of the status quo here is I'm not feeling well. I'll put it off for as long as I need to until it gets to a point of difficulty or trouble, and then I'll go and see a clinician. And sometimes, and what we've seen over the last maybe 10 or so years, is that unlike our parents who had the same GP to go to for the longest chunk of their life, many people don't have their own GP or a regular GP they go to. They just try and book in whenever they need to. So the idea of having a dedicated GP and a support system around that, I think, is absolutely fascinating. Why was it that Asana was created in the format that it was? I mean, it could have been, you and a set of GPs doing something in, one clinic and just trying to support a particular suburb or a neighborhood, but you're looking to scale and grow this. What is the vision for Asana, as it goes? We have three clinics at the moment that we engage with. How do you see this rolling out over time?
When we work with government, state and federal government in Australia, as well as with health insurers, we also saw the opportunity to follow other health systems that have made a transition. And that transition has been from reacting to when patients get sick, because that's often quite late in the piece. And
Mhm.
unfortunately for people in that health system, it can be quite costly and quite challenging to be in hospitals, having procedures, taking lots of medications, seeing lots of specialists. So we wanted to wind the clock back, and we saw a huge opportunity where others have actually taken the lead and proven out successful examples of being able to do this at scale, which is to look after populations in our community and apply preventative medicine across the board so that we can keep as many Australians as healthy as we can. So we don't need to keep building hospitals and use our tax money on when sickness actually happens. And so the vision for Asana is really to build 3 clinics, prove to through research, which we are working with a group called the Georges Institute for Global Public Health. They're an international research organization, and we're collecting a lot of data to prove that prevention essentially is better than cure. And in 3 years, we have reduced hospital visits, we've improved clinical outcomes, and we're reducing the health risks for all the members that we're looking after. And our vision is to be able to do this in other locations around Australia.
So it's, I mean, to remind people, if people are furiously Googling Asana Care right now and taking a look at what's on their website and trying to understand what that is, please go ahead and reach out to the team so you can understand more about what that can mean for you as an individual or you as your family. Like I said, for our family, it's been quite an extraordinary process to go through. And the ability to sort of move all of our medical records across to Asana has actually been, it'll be a very straightforward event, given that we've just come on board now. I wonder, Kevin, when we talk about trying to find, if people are outside of Sydney, what is the best way for them to try and engage with your organisation right now? What does the future look like if somebody is dialing in from, say, Melbourne, or if they're in Brisbane, or maybe further afield inside New South Wales? What's the best way for them to engage on this new model of healthcare?
Mm. We're building an IT platform that will enable us to help people outside of Sydney. So that's coming over the next 2 to 3 months. A lot of healthcare, similar to other industries, is going online. So the world of e-commerce, being able to access services digitally. There are some clinical situations where we do need to see people face to face,
Sure.
examine the breathing, if there's a chest infection, do tests such as blood tests, and sometimes building rapport so that we can help people in a therapeutic relationship is quite important, sometimes face to face. So not everything we can do online. So that's why it's always going to be a blend of bricks and mortar, being able to provide a medical service face to face, but doing a lot more of the what we do online in a digital service as well. So over time, we'll be able to help people outside of Sydney, but right now it's going to be focused on those in Sydney, a hybrid between telehealth and also through our clinics. We know that continuity, to your point, Phil, is really important. The research shows that having the same GP, the same consistent point of care, allows the clinician to actually help patients a lot more. And research shows that you get a much better outcome from that continuity of care. Put it this way, you can actually do a lot more things through telehealth if your doctor actually knows you. If it's a random clinician, they don't know you, they don't know your background, there's actually limitations around what can be done through a phone call or a video chat. So if you're in other parts of Australia, go talk to your GP, encourage regular checkups, and find a way to build an ongoing relationship with the GP is really important.
Yeah, it's a great point. And to Mary, yes, thank you for joining us. Even though you are in another meeting, we'll definitely get you a recording of this because it's opening up to be a fantastic conversation. And so, Kevin, when we talk about the idea of fast medicine versus slow medicine, there's this idea of, we've all experienced the 15-minute appointment schedule for a GP, and it's not their fault. It's the way the model is sort of built around this. You go in, and as I've sort of described this to my team, I imagine it's sort of 5 minutes to try and meet and greet, understand what's going on, then another sort of few minutes to try and work out what's wrong, and then to also then try and determine what the course of action or not is, all within 10 minutes before you've got to move to the next patient. And I'm pretty sure for those who studied medicine and went through that enormous education process, it can feel as though that might not be as satisfying for them, given how much they've got to sort of be across and how quickly they've got to context switch between every different patient interaction. When compared to slow medicine, which is this idea of spending more time getting to know your clinician, being able to provide all the right context, what have you found with the patients that have come in and transitioned into Asana? How have they characterized that change of experience for themselves? Is it just a fundamentally different sort of shoulder dropping relief? Or is it something which is so foreign it takes a little while for the patients to get used to that sort of level of proactive, slow down, have the conversation, understand things in detail? How do patients sort of react to that?
Yeah, it's a great question. I would say there's probably a mixed bag, and it's a change process for everyone to adapt to something new. So it depends on your starting point. We see from newborns, we're seeing COVID babies at the moment, all the way to we manage a handful of nursing homes in Sydney, and so we've got those that are 100, 105 year olds as well. So there's a full range. Um, some patients would have been looking for a service like ours.
Mm.
They can't put their finger on what's wrong with them. They're seeking second opinions. And if we listen to a lot of the surveys in the medical industry, so patient surveys, patients don't feel heard. They feel rushed. They wish they had more time with their GP.
Yeah.
So it's not always a great experience. And the tricky thing with healthcare is if you think about some patients being VIP customers because they have more healthcare needs, they've got more health conditions, actually it becomes more challenging for them. So the experience for VIP customers is definitely not a VIP experience.
Right.
On the flip side, the experience for clinicians isn't always great when we rush as well. And the reason why the average Australian consultation time for GPs is between 12 and 14 minutes, and it's become faster and faster over time, is because of the way Medicare is funded. It's funded for every activity, and it's
Mm.
not necessarily funded for how well doctors listen, how well we diagnose, whether we get the right treatment in place, whether or not patients improve on their health. So all of those things play a secondary consideration to how many consultations do we do, and so that it really becomes a focus on activity, unfortunately. And so when we are practicing in 10 or 15-minute allocations, it's very hard, as you say, to have a meaningful discussion in that amount of time and squeeze everything else in that we have to do. We have to manage an infection, we have to manage medication, we have to do screening and blood tests, we have to listen to everything else that's going on in that person's life, because it's so important to be holistic and considering um, other triggers, stressors, it's pandemic, what's happening with work, relationships, all things affect your health. And so that's the challenge with fast medicine, which is where the current health system is going. And we are trying to practice the opposite, which is slow medicine. So similar to the analogy with slow food, we know fast food isn't always great for us. And there is a movement which is around slow food. So if you cook ingredients and then you focus on things that are natural, less processing, then it's actually more wholesome for your health. And we apply the same approach to medicine. When we spend more time with our patients, we have more time to listen. We build a relationship, so it becomes more a stronger partnership.
Mm.
And we actually get to the bottom of issues as well, which is so important. There are so many things that we can pick up through screening
Yeah.
to detect health risks. And if we can find out things that are either a risk or a problem, then we can do something about that. And that's how we've been able to get better results than the rest of the health system.
And it's I guess it's fascinating because we always talk about asking why 5 times, right? Trying to get to the nub of the issue, and sometimes it's not the language to interpret or put around an issue that somebody's feeling or sensing or has been affecting their health over time. One of the reasons that for everyone listening, the reason why we came together with Kevin and his team beyond a mutual old friend that connected us in an absolutely fantastic way and sort of ignited this conversation. It was a conversation after that which led me to understand just how important tracking people over time is from a healthcare point of view. And so, to give you an example of this, one of the ways in which members of Asana are able to give insight to their doctors so that there's able to have this a really constructive set of conversations is that there are from time to time surveys sent out to be completed by the members, and that is longitudinal data, so it's tracked over time, and it gives really interesting insight because obviously whenever you're unwell, really the only time you'll get a blood test, for example, is when you're unwell. You won't get ones when you're typically healthy unless you're part of a corporate health plan, which few of us are. When it came down to this idea of longitudinal tracking, we discovered that from a mental health point of view, there's a survey that goes out over time to the members, and it was able to show as COVID sort of started to hit that there were some changes, obviously, in people's mental health. And we became really actively interested in mental health on the biological side and the work that we do at Drop Bio from a research point of view, because over the last 20 years, the amount of literature that we could find pointing towards the role of objective biomarkers, so things that we can see in blood, molecules and hormones and the like, we can see those changing over time. But the reality was a lot of those studies were done measuring one marker at a time. And because we're a system and a human biological system, we need to try and find how we could look at more markers over time. And our technology allows us to do that. And so one of the things that we're pioneering with Kevin's team jointly is this idea of being able to use small amounts of blood that would be collected from your finger to try and work out if there's a way to objectively triage the way somebody is suffering a particular mental health condition, with the complete objective of trying to get them the right level of care as quickly as possible. Hugely important for both clinical practice like what Kevin is in, but also at a public health level where we just know that so many people are suffering of mental health conditions, particularly through COVID, and the ability and the time it takes for them to get access to the right treatment is so prolonged that we're hoping that this piece of work we're doing together is going to help inform a very fundamentally different way of doing mental health care. And so, Kevin, let's just sort of pivot into mental health a little bit then. So we're seeing obviously many people are struggling with homeschooling. I speak of as one of those people right now. Homeschooling, working, not being able to have that social connectivity and cohesion that we all love more now than what we probably expected previously. What are you seeing in sort of the Australian mental health landscape in terms of rising incidence and the way that's sort of impacting not just families but also public health as well?
Yeah, it's a great topic, and we are really excited about our partnership to investigate how we can improve mental health outcomes. And I wear a hat as a mental health ambassador for the Mental Health Foundation in Australia as well. So this is sort of close to my heart. The stats are astounding. It's 1 in 2 Australians will suffer a mental health illness during their lifetime. And it's been a rise during the pandemic, as you say. We've seen, for example, in the workplace, mental health as a reason for workers' compensation claims has doubled during 2020. So there's been significant increases, even within our own service. We track a longitudinal survey, as you say, every 6 months. We use a standardized questionnaire called the K10 survey, which looks at common symptoms such as depression, mood, anxiety. And we've seen those scores increase over time by virtue of the anxiety around COVID, but also, as you say, a lack of social engagement. That social isolation is really important. The longest survey in the world, done by Harvard University, has looked at 4 generations, and by far the biggest impact on health is actually our social connectivity. It's not your genetics, it's not your access to medical care. It's actually how we as human beings interact with each other. So that actually has grown in importance over my time as a clinician over the past 20, 25 years. And so we're really starting to just getting to understand the importance of mental health and how it interacts with physical health. As a GP, what we have seen time and time again is a huge lag and a huge delay between the onset of symptoms and when mental health conditions are diagnosed and picked up. And then there's a huge delay and another lag between the diagnosis and treatment and the review of treatment regimes. So what we're really excited about is being able to detect mental health issues earlier. There is no current blood tests for mental health conditions. It's very much a clinical diagnosis. And we know that there can be some access challenges getting to see your GP, getting to see a psychologist or to a mental health service, given that there's increasing demand at the moment. So it's so important to be able to get in early to detect and diagnose, but also to treat and review over time as well.
Yeah, it's interesting, isn't it? Because if people are interested to sort of understand what this means from a research point of view, and a plug for the Wellbeing by Drop service here, what we found is that people who often want to look after their health are also very likely to want to contribute to medical research. They've just never been asked to participate before. And what we've found is that as people come into wellbeing by drop, as they do in the Asana context and their separate contexts, you're provided with the opportunity to provide your informed consent to participate in research just like this, where we're trying to accelerate that pace of research. So for people who have not been involved in clinical research before, one of the key things that makes it really difficult to pull off studies which are, have the right number of people, can have the right gravity so that the outcomes can be real and can be translated into the literature, is the ability to recruit people into these studies. And so we've built that into our work at Wellbeing by Drop so that people can have that opportunity. You don't need to participate in the research if you don't want to, but it's certainly an option that's presented to you up front. I know the same is there for Asana Care, and it's really important because this is the way that we create the evidence to make a shift, because everything in healthcare, whether it's Drop doing this in wellness or Asana Care doing this in a clinical context, evidence matters. And so the only way we really generate evidence is through clinical trials like the ones that we're talking about. And your participation really does personally contribute to the way that we can move the needle on changes like this. It's really quite fascinating. Kevin, we've got some questions from the audience that came in prior to pressing play on today. So I'd like to sort of run a couple of them by you. It's almost like a quick fire. I've even forgotten the day today. Quick fire Tuesday, Wednesday, Thursday, Friday. Let me level a couple of questions at you and see if we can get these answered. All the questions relating to community we've got in the chat box there. All the links you need to come and join and understand more about both Asana Care and also the drop-in. We'd love to have you join both. And you are most welcome. We've talked already about what happens if I'm not in Sydney. We've talked about how people can connect, but it's still very important for you to reach out to the Asana team because they can still very much help you out. The key question that I can see here in this list, which is often one which is a roaring debate, is this: Kevin, is it too late to prevent my health from deteriorating? And this is coming from people that might already be suffering or have a family history of type 2 diabetes, poor liver function, cardiovascular issues. Is it ever too late to start doing good health practices?
The short answer is no. We do lots of great preventative care in 100-year-olds in nursing home settings. And so there are different types of prevention, and prevention is a broad umbrella. So maybe I could touch on some of the different definitions that we use within the medical industry. Primary prevention is essentially ensuring that we live healthy lifestyles. We eat well. There's great evidence on exercise, managing stress, getting good sleep. If we have children, it's keeping off screens, not sitting down too much, being active, getting outdoors. All of those things can really optimize our lifestyle risk factors. And so they can counteract some of the genetics that we may inherit from families and from our environment. So that's considered as primary prevention, and everyone can do more. We know that 60%, 70% of Australians don't follow dietary guidelines that are recommended nationally. We know about 80% of Australians don't necessarily follow exercise guidelines that are recommended. And so there is an opportunity for a majority of us to have healthy habits at home. The secondary prevention is also important. So if we do have onsets of symptoms, we are diagnosed with disease, then a lot of the disease mix, the pandemic aside, are around chronic health conditions. So we're talking being overweight, having diabetes, having heart disease, arthritis, asthma, lung disease, even cancer. And a lot of these can be prevented. 80% of heart attacks can be prevented. 80% of diabetes can be prevented. Almost half of the cancers can be prevented. So there's a lot that we can do to either prevent the disease from occurring, or once it's been diagnosed, it's not the end of the world. We can actually stabilize the disease and improve your quality of life. And it's all about great medical care in conjunction with self-management at home. And then even if diseases do progress, so as we get older, we might be impacting our quality of life with arthritis, with operations that we may have already had, with conditions that have already been diagnosed, be it high blood pressure, cholesterol. We might be seeing multiple specialists. And so tertiary prevention is about how do we maximize our quality of life at home and stay away from from expensive hospital care, from having surgery, from needing more medications. So there's different angles and definitions of prevention: primary, before disease's onset; secondary, once you get diagnosed with a condition, how do we keep it stable and prevent complications? And then tertiary prevention, which is as we get older, how do we stay at home so we can avoid unnecessary healthcare?
Yeah, it's a really good point. Can we just dive into that comment you made about, the large proportion of people that don't follow those particular guidelines? Like, what's up with that? Why is it that people are like not doing that if they know that it's good for them? Is it just that it won't ever happen to me and that I'm going to be fine and that I'm just going to return to the couch now because I've got another 7 episodes of that great series on Netflix to finish watching? Like, what's the story?
Mhm. Well, that's a magic question, isn't it, Phil? We all have New Year's resolutions, but a majority of us don't follow through, and we know that change is hard. In my corporate career, I was a change consultant, and we saw 2/3 on average change programs would actually fail. So changing behavior is hard. And in order to make change successful, though, we need to understand why we need to change. So what is a healthy diet that we should follow? What are the ways to exercise, even if you have sore joints, even if you have physical constraints?
Yep.
How do we get better sleep, not just more hours, but better quality sleep? How do we manage stress? So there's an element of knowledge and skills that we need. But I suspect a lot of this is not just the skill, but it's also the will. So what is the motivation and our confidence to kind of follow through? And that's where there's a world of what we call health coaching, which we've embedded into our service, of how do we set goals? There's great science behind, we all have goals,
Yep.
but if we write them down, we're 40% more likely to achieve them. And if we write them down and we share them with our family and friends who keep us accountable, we're 70% more likely to achieve them. So how do we actually stick with our goals and follow through? And it's around the motivation, and sometimes it's seeing role models, it's having the incentives in place, having the accountability of those around us, because those things are just as important as what we actually need to do. So the knowledge and the skills as well.
Yeah, it's interesting, isn't it? We participated in the push up challenge in July, which was for mental health, and they ended up. I think it's the fifth or sixth year that they've run this, maybe fifth year. They ended up raising $5.1 million. There was millions and millions of push ups done, and all types of exercise across the board. In our team, we asked people, even for the drop in and beyond, to join Team Drop, and every single day we were able to see how everyone was participating and performing against that, and that reinforcement. It was really putting, a bit of vulnerability, putting what you're doing out there to see what was happening, the jokes and the banter and the fun that was sort of created through that, and the strength that was gained through that, and the disbelief that was dispelled by people thinking, I can't do a push up, I can't do a lunge, I can't do these things. Very quickly went out the door because it was all of us driving in the right direction. I think it's fantastic. I actually didn't know it was 40%. If you write it down, it can make things change. It's a fascinating statistic. Um, can I ask a question of you about how, if somebody was to make a change today, we know that um, changes and good intentions can be very broad and very deep, but sometimes it just needs to be one thing that you would start on a journey towards change. Is it a change in diet? Is it a change in sleep? Is it a change in the way that you engage with people? If somebody had just to start one thing on day one and then maybe something different on day two and beyond, where would someone start? Like, what would you say to somebody if you were sort of, you didn't have a lot of detail about them? What would be your sort of first pro tip for them to kick off with a good change towards a healthy tomorrow?
Good question. I would pick whatever is interesting and fun for the person and aligns with one of the major lifestyle interventions that we would prescribe these days. And so
Right.
there's a wealth of knowledge that is building around the importance of exercise. Exercise is great for metabolic disorders, great for inflammation, It helps with mental health conditions almost as much as medications that we prescribe.
Yeah.
So exercise is one, but exercise means different things to different people. So for some, it might be walking around the block every day. For others, it might be getting on their bike to do something a bit more intensive.
Yeah.
And so exercise is one area. Another is nutrition. We know that there's a big focus on less processed foods, less sugar and carbohydrates, more plant-based diets. There's a wealth of evidence around that for everything from dementia risk to cancer, cardiovascular risk, and also for healthy weight as well. Managing stress is an important one, and it's not just services within the healthcare system. There are lots of self-care interventions that are evidence-based. Everything from going outside to seeing green trees, walking in nature, socializing, creative pursuits like singing. And I just wrote an article on things that you can do during lockdown. So you can kind of pick any of these topics. Others could be mindfulness, meditation, yoga, Tai Chi, Pilates, all great evidence to improve health risks and conditions. But the most important thing is to make a start. So think of it as micro habits. And I love for push-ups, for example, one of the stats would be, and this was done by Harvard on men only, so in terms of application to all genders. But if men can do 40 push-ups in a row, that you have a 90% lower chance of having a heart attack than people who can't do 40 push-ups in a row. So how do we get there? And 40 push-ups for me was initially quite hard, but getting started and then working on 10, working on 15. I love Richard Branson has a good approach on this, which is he does 5 minutes of exercise every day, rain, hail, or shine, and he just has to do it. And then at the 5-minute mark, he can decide to keep going or to park it and go do something else.
Oh,
but the first 5 minutes is non-negotiable. Yeah. So in terms of building micro habits, it's keeping it really practical. Make sure you pick something that's fun, that you feel confident in working on, and then tell someone about it so that they can check up on you and keep you somewhat accountable.
If ever there was a stat to take from today, and I think the majority of people on this listening now are women, for your male partners, for your brothers, for your fathers, 40 push-ups a day. They can start small, get them to that point, reduce that risk. It's a fantastic equivalent of what you can be doing. I find the mornings that if I don't get out and smell the fresh air early in the day doesn't usually go as well. And I can only, when you have a chance to get out in the morning, that would without doubt be my non-negotiable to get started. So interested to hear what people's habits are. If you'd like to tell us what your daily micro habit, the one is that you're most in love with, throw it into the chat box. It'd be great to see what you get up to.
Morning exercise, by the way, Phil, it gives you about a 15 to 20% better sleep improvement, quality and time in deep sleep. So yeah, morning's the right time to exercise.
Excellent. And for anyone who uses services like Strava and the other ones to track and share, I find it absolutely, Joe, a morning walk it. Yep, I'm with you. Being able to share and see what other people have done on their morning exercise just feels like a reinforcing and fun kind of way to see the views that people have first thing in the morning. And sometimes when you see somebody who's done a walk in the morning in Perth, and they're looking over the Indian Ocean as the sun is sort of starting to rise in the opposite side as it comes across the sky. It's amazing. Then you see people at Manly, people in Melbourne, such amazing sights to take a look at. So if you're not on Strava, I highly recommend you do. We obviously have no affiliation with Strava, but it's a great tool to use all the same. Now, Dogs to the Walk from Carol Ann. Yes, plenty of dogs out at the moment, and I think they love getting out as much as we do. I'm almost certain that's the case. Now, and I know that Abby Batchelor, who works with us here at Drop, is a massive meditation fan. She put me onto a very clever app called Down Dog. I don't think I've looked back ever since starting to use that because I have the flexibility, or I did have, of a chess player. So very pleased for that's not the case anymore. Kevin, we've got a question here which does relate to mental health. We were just talking about it before, and it goes like this. I'm 60 and noticing that my mind isn't feeling so sharp these days. What can be done as part of a preventative approach to mental fitness?
Great question. And I know someone was going for a walk every day for 15 minutes, and walking is great. So not only is it good for what we call cognitive mental fitness, I was just looking it up, a 20-minute walk every day. Not only are you burning the calories of a bag of chips, but you're actually lowering your risk of death by 30%, and you actually improve your energy levels by 20% as well. But in terms of keeping sharp, there's lots of lifestyle basic things that you can do at home that are kind of evidence based. And keeping your mind active is a key theme through all of those things. Learning, we know that when we learn, we build um, neural connections that increase your white matter. So actually, you're not only sharper, you improve your memory, but you actually slow the rate of any decline in your mental health or your thinking. Um, Nutrition is important. And a lot of the evidence gravitates towards what we call the Mediterranean diet. So again, lots of plants, grains, less processed foods, less meat in this example of the Mediterranean diet. Um, Not smoking, moderating alcohol intake, and then exercise. Exercise is a big enabler to mental fitness. And probably the last one to mention is social connections again.
Mm.
Um, Not only are hobbies and pastimes great to keep your mind alert. So the adage of doing crossword puzzles, playing mahjong, playing cards is great, but doing it with others has the added benefit of improving your mood as well.
Yes, and if you have young kids, I can only recommend Rat-a-Tat-Cat. If you haven't got that small card game, there are fierce competitions in our house between my wife and our daughters around Rat-a-Tat-Cat. Fantastic game, very cheap, and a great card game to pull out in any kind of situation. Also good to try and resolve any kind of conflict as well. Kevin, we've got a question here, which relates to the women's equivalent for the daily push-ups realm. And the question is, how many push-ups for women to do daily? We can do some research into that and see if we can find some good evidence around that. I don't think we've got anything to hand at the moment, but we can absolutely talk to that shortly. One thing that's very topical across the world at the moment is the push towards vaccination for COVID-19. We have a number of different debates. There's a lot of misleading information that's going on around different vaccines. There's disinformation as well, which of course is a distinction. And then we've got people who just really want to get that protection across the board. Just from the Asana point of view and the kind of advice that you're providing to members there, what's the standing guidance around seeking vaccination for COVID-19 for different age groups, maybe male and female? Is there a particular point of view that Asana's formed around this to date?
We follow the government recommendations at the moment, and we want to make sure, probably foremost, that there is consistent messaging. There's enough confusion and changes out there at the moment, which is creating some hesitancy across the industry. And
Mm.
so, the best way to protect ourselves and our families is to get vaccinated. We've been very surprised. So we know that vaccines have been accelerated. Normally, it would take 10 plus years to go through clinical trials and create not only new vaccines, but a new type of vaccine, which is what COVID vaccinations are. But for the most part, they have actually exceeded expectations. So when the experts look at the effectiveness of vaccines, they were 85 to 95% effective, the initial strains against the initial strains of COVID, and even against Delta and Lambda, which is the new one. The effectiveness is still in the high 70s to 80%, which is, by the way, much better than the annual flu jab
Yep.
that Australians get. So definitely vaccination is the way to go. A lot of the hesitancy also stems from side effects. Now, there are some very common side effects, which is hitting about 60 to 70% of folks when they go get their first or second COVID vaccination.
Mhm.
Usually it's worse for the first for Astra, usually it's worse for the second Pfizer, but about 60 or 70% get some flu-like symptoms, headache, fever, sore arm in the first 2 or 3 days, and it goes away. So it's no lingering effects, and it's safe. So that they're common. The uncommon ones are the ones that need some perspective, and these are the rare blood clots. They're hitting about 1 in 50,000 at the moment. And when you think about it, all medications and medical interventions have side effects. You're about 8 times more likely to get a blood clot if you actually get COVID than the vaccination. You're more likely to get a blood clot if you step on a plane to go anywhere. So, and common medications like aspirin also have side effects. In fact, people get serious side effects from aspirin, 1 in 10,000. Whereas aspirin is available through Coles and Woolies. So we just need to put some of those things in perspective. And given the current outbreak, our strong recommendation is to get as vaccinated as quickly as you can.
Yeah, thank you for that. I think a number of the team, we have a relatively young team at Drop, and so everyone's just keeping an eye out on the best way to engage with that. I know most people are very excited about this in the general community. I think when it comes down to the first and second shots and the side effects that I've had, I had my second Pfizer shot yesterday. No side effects at all. It was quite something. It was actually interesting being out at the vaccination centre at the Olympic Park. The number of people that who are sitting in the observation area after you've had the second shot, just waiting to see that everything's okay. The number of people in tears there who were, I think, tears of joy, just sort of realising the kind of coverage they'd just gotten as a result of being able to participate in this kind of program was really quite something. It was quite a sight to behold. Notwithstanding all of the language and things that are around this right now, it's something really incredible. And when we look back on this, I'm sure in history in 100 years' time, there'll be this thing called COVID-19. And I'm sure medical researchers will look back and say it was the fastest point at which we could actually generate really effective vaccines. And it was a step change in how quickly the world could move when we're all sort of aligned around this. There's a question here for you, Kevin, from Abby, which is, what about the history of chronic illness and immune issues in the context, I think, of COVID vaccines? How is it that you engage with your members around that if they do have an underlying condition? I imagine it's a pretty intimate conversation to weigh up the pros and cons.
That's right. For the most part, most chronic conditions are fine to go ahead with vaccination. In fact, there's more of a pressing need. When we take a step back and look at the statistics around the world, those that unfortunately ended up in hospital, deaths even, so serious COVID disease needing ICU support, those are the ones with chronic health conditions that were potentially not well managed. So point number one is to make sure that your GPs, you're working with the GPs to make sure you're on top of your medications, any health risks, such as the importance of preventative health during a pandemic. If you have chronic health conditions, if it's well managed and you get, touch wood, you get COVID, then you won't go to hospital. That's essentially what the statistics are telling us. That said, most chronic health conditions we can vaccinate. Cancer, chronic health conditions such as hepatitis, even immune disorders. The only one that we need to be careful about is to make sure that any prior history of heart conditions, because there's been reported heart inflammation in Pfizer vaccination, and any clotting disorders, although there's a range of clotting disorders, so not all clots are the same. For example, the common clots that we get after an operation, being on the flight, even taking common medications such as a contraceptive pill, they form clots in our legs that can sometimes travel to our lungs. And the clot that we're talking about is an unusual one where there's bleeding, but also platelet aggregation to cause clots in the base of our neck. So different clots, it's worth discussing with your GP and your carers. But for the most part, the main message is those with chronic health conditions, it's generally safe to have vaccination.
Excellent, Kevin. A very